A very good morning to everyone. My name is Kenneth Kok. I'm Deputy Dean for Undergraduate Studies and Global Health at UBD here. I think first of all, I would like to welcome our friends and colleagues from Universitas Indonesia, as well as Universiti Kebangsaan Malaysia. As you can see from the program book, my talk will be on medical education in the new norm, the opportunities and challenges. So what I plan to do for the next 15 to 20 minutes or so is to look at the impact of the pandemic, the COVID-19 pandemic on medical education in general, and what we did for teaching and learning at the Institute of Health Sciences here in UBD during the few phases of the pandemic, and also how we assess the medical students during those pandemic waves. Then I will try to compare the benefits and drawbacks of virtual learning and assessment to those of the traditional learning and assessment. And finally, what I think the future of medical education will be like in light of possible future outbreaks. So it all started, we all know, back in March 2020, when the COVID-19 outbreak, which was caused by the SARS-CoV-2 coronavirus, was declared a pandemic by WHO. And since the declaration, governments around the world, they have implemented protective and preventive measures, such as closure of non-essential businesses and educational institutions, implementing strict travel restrictions, and also mandatory quarantine of cases, because at that time, it is known that social distancing was considered the most effective preventive strategy. There was, of course, before the advent of COVID-19 vaccination. Because of the pandemic restrictions, it has caused unprecedented global disruptions, affecting every aspect of life, including education. Medical schools and healthcare institutions, because of the pandemic restrictions, had to implement a few measures, such as the cessation of on-site classes, the suspension of clinical attachments, and even restructuring of students' examination during the pandemic restrictions. In Brunei, it all started on the 9th of March 2020, when the first case of COVID-19 was detected. At that time, during the first wave, all the lectures were converted online, and the laboratory sessions were staggered, and we were mandated to have an alternative mode of assessment. And this carried on until we had our second wave, which was declared on the 7th of August 2021. During the second phase, the teaching and learning in UBD were as follows. First of all, there was no on-site teaching. All the lectures were therefore had to be shifted online. The laboratory and practical sessions were all suspended, and the staff and students were advised to work from home. And of course, because of the pandemic restrictions, there were no clinical visits or placements in any of the hospitals or clinics in Brunei Darussalam. So for those students who had clinical rotations, they were all suspended. And for the end of the semester examination at that time, we had to come up with an alternative mode of assessment other than a face-to-face examination. So this is what happened during the phases of the pandemic restrictions. Our usual PBL classes, as well as clinical sessions, had to be moved online. So we utilized the University e-platform, the Canvas, but in addition to that, we also used Microsoft Teams, as well as the Zoom platform. Therefore, our PBL sessions were moved completely online. the lecturers were advised to deliver their lectures online. Some of them did live lectures, others used videotaped audio slides, and some lectures are quite innovative. They have slides as well as quizzes built in as well. As far as the clinical and communication skills sessions were concerned, the part that involved the communication skills, we were able to deliver them online. And some of the procedures, the practical skills, we were able to deliver them using clinical videos. However, there were some clinical skills which we thought difficult to be conveyed online, had to be postponed. And of course, our clinical placements, as I mentioned just now, were all suspended. And in some of these instances, they were replaced with online case scenarios and case reports. For our first year medical student, they have to do what we call a special study module, which is a research module, sort of a research module where they had to follow a pregnant woman throughout her prenatal, antenatal, post-delivery, as well as postnatal care. And obviously, this would have to involve a lot of patient and family contact. But unfortunately, due to the pandemic, we were not able to do that. For the SSM2, which is the second research module where they have to do in their second year, for this particular research modules, the students had to do an individual research program. And because of the pandemic as well, they were not able to carry out the research project. So there were a few ways we accomplished this. First one is by the data collection by designated gatekeepers in hospitals and clinics. This would mean that either nurses or designated clinicians who were assigned to collect data for the students. But unfortunately, because of their busy schedule, some of these clinicians were not able to collect the data for the students. And for some of the students, we had to convert their research projects into retrospective studies, and some of them even just to literature review. And for a number, I think about 5 or 6 of them out of about 33 students, we had to completely change the research project. And for the third year, there was a SSM3 or Special Study Module 3, which is a group community project in that the students would have to go to the community where they would have to have face-to-face contact with the public to bring about awareness of their project. And because of the pandemic, all the projects had to be modified. For example, the public forum and public lectures had to be carried out online, and some of the live demonstrations, such as basic skills, had to be converted to video presentations. And there was an increase in the use of social media in order to raise awareness of the topics that the students would like to inform the public. And interestingly, they also, for the physical activities such as the runs and jogging and all that, would have to be converted to virtual runs. And we found at the time that we have actually included an additional assessment for these students. So in addition to the usual assessment that they have to do, we even included a section on the resourcefulness in ingenuity. In other words, how the students are able to use the social media as well as the virtual platform in order to carry out their project and to bring their message across to the public. What about assessment during the time of the pandemic? Well, some medical schools, the exams were either delayed or postponed altogether. Delay may affect the motivation of students to study, and of course, it can cause distress and uncertainty among students. In UBD, in IHS UBD, because it's a high-stake exam and a summative assessment had to be carried out because it is a requirement by our partner medical school for the students to be matriculated to the partner medical schools. So we had to come up with an alternative mode of assessment besides the physical assessment. So for research presentation and case presentation, it had to be conducted online, virtually. We had to come up with online written examinations, and we had to also come up with online OSCEs during the strict pandemic restrictions. As you can see from this slide, for the oral presentations in the top corner, you can see what the students are normally required to do, in that they have to present. These are for the SSM3 projects, the community projects, where they have to present their findings, their write-up of their report. But during the pandemic, it all had to be done online. So the students will have to do it online, as well as all the SSM1 and SSM2 projects, and all of them were conducted online. These online platforms that we use is either a Microsoft Teams or the Zoom platform. For the written paper assessment, we had to use the e-platform, the Universiti e-platform, which is Canvas. So what happened was the questions were set and published before the start of the examination. And because the examination was conducted online, we had to come up with a way to invigilate the students. So we did this using Zoom video conferencing. But what we found is that a lot of setup time is required. For example, testing of the equipment, positioning of the phone to make sure that we have a complete view of the screen as well as the students. And with this, we use Zoom. For the OSCE assessment, it was all conducted using the Zoom platform. For communication skills, the students were required to take specific medical history from simulated patients online. As far as the clinical skills stations are concerned, instead of students demonstrating certain practical or procedural skills, the students were asked to describe how they would perform certain clinical skills or tasks. So those were the platforms that we use during the pandemic time. Of course, as you know, there are other platforms, there are other innovative methods available in order to continue the educational process. So in addition to the online lectures, the clinical, the videos, some centers have used virtual simulators, webcasting, telehealth, and even virtual reality platforms. And as far as the assessment is concerned, they have used web-based clinical case vivas. Students in some centers were asked to demonstrate practical skills on virtual mannequins, and others use online OSCE like what we did. So what are the benefits and drawbacks of virtual learning when it's compared to traditional or in-person learning? Well, for traditional in-person medical learning, which is what we all used to, it allows direct interaction between students themselves, and also between the students and the lecturers. And for real patients, it obviously allows hands-on exposure. And there is also direct student feedback and assessment at the time of the student-lecturer contact. And the other advantage is that you can organize the time and you can set boundaries. For example, students spend certain times in the university, and certain times they are entitled to their own times at home. And it provides, as I said, a good opportunity for procedural skills. And also, in addition to the knowledge and the practical knowledge, the students also learn about the dynamics of patient interaction. There are also certain drawbacks with the traditional in-person medical learning. For example, there is lack of innovation, and it relies a lot on the presence of the lecturer most of the time. And student-lecturer contact, it can be a spoon-feeding experience. You know, student is there and the knowledge and the skills is just directly fed into the students. And the other drawback is that it can be time consuming when you're moving from class to class. I still remember when I was in medical school, running between two lectures, we only had about 5 minutes. So it's from one lecture in one building to another lecture in another building. By the time you reach the other side, you were like, you know, gasping for air, let alone trying to learn something. And the other thing is about the classes. If the classes are huge, so it can be crowded as well. What about virtual learning? What are the advantages, the benefits, and the challenges or the drawbacks of virtual learning? Well, the benefits of virtual learning are it's easily accessible. You can do it anytime, any place, and you can do it in a safe and the comfort of your own home, a safe environment. And most of these lectures, if not all, are recorded, so you can have repeated access to the lectures at your own convenience. You can do it flexibly anytime that you want, and it enhances the students' independence and also their self-learning capabilities. And most of this online platform have access to educational materials and resources, which the students can access to them easily. And it also provides skills in online teaching and also on the alternative modes of assessment. The drawbacks on virtual medical learning are, it depends obviously a lot on the reliable network. For example, the hardware, the software, and the network bandwidth as well. The online platform may not be compatible with the university's existing learning management systems. You need a very competent IT technical support. And because learning is on your own, you can feel isolated, and sometimes it can be very stressful, and which may even lead to the lack of concentration. There is, of course, the minimal interaction between peers and faculties. And for virtual learning, there is potentially a lack of hands-on exposure. You do not have access to laboratories, to specimens, to models and prosections. The reason for this is, of course, even the simulation centers are closed, so they are not accessible to the students. There is a lack of direct assessment, and for the virtual medical teaching, it's almost impossible to acquire the non-medical skills such as leadership and teamwork. And for some of us who are technophobia and with poor computer technical skills, it can be quite a challenge as well. What about the virtual assessment when it's compared to traditional assessment? Well, for the virtual assessment, the benefits of the virtual assessment obviously will be the flexibility, and it's economical because it is cheaper, hopefully, to do that, and it is environmentally friendly because you do not have to print hundreds of pages of examination papers. And some of these platforms, e-platforms, have auto grading, which makes the marking easier and faster. And for the OSCE as well, it is flexible for both the examiners and students because, for example, in our OSCE, more than half of our examiners will be clinicians. And sometimes it would be quite a challenge to organize an OSCE to get all the clinicians in one place. So with the virtual assessment, the clinicians can actually stay in their own office and do the assessment from there. Studies have shown that the assessment for history taking and communication skills, as far as the virtual OSCE is concerned, meet the basic minimal standards. The drawbacks, however, for virtual assessment were obviously, as for the written paper, it depends a lot on reliable network. And it can be a challenge if you are not technologically inclined or you're unfamiliar with the platform that's been used. There is a possibility of violation of rules for examination, for example, cheating and easy access to textbooks and things like that. And we have also found that it's quite difficult to grade long answers. So for single best answers, it's easy, but for short answer questions or for essay questions, it can be a challenge to mark them or to assess them. And for the virtual OSCE, as we are all aware, there is a limited ability to assess clinical and procedural skills. And also, in terms of non-verbal communication skills, it can be quite a challenge to assess them as well. And by talking on the laptop and talking to a patient or simulated virtually, there is a lack of clinical authenticity. Usually, most of the clinical consultation is done face to face. However, having said all that, we have found that we conducted the virtual OSCE as well as the online examination successfully. So in our view, a good teamwork, a very skillful coordination, and very importantly, a reliable high-speed internet connection. They are all essential to conduct a successful online examination as well as OSCE. This is just a raw data, a glance of the results comparing both the virtual as well as the physical exam. So as you can see, for the orange columns, that's the physical exam back in 2019. And for the blue column, those were the virtual exam conducted in 2020. And just a quick glance, if you look at the graph on the left, you could see that most of the patients, most of the students who did the virtual exam actually did less well compared to those who did the physical exam. In other words, they had more grades towards the lower end, i.e. B+, C+, and C. That's for the written paper. For the patient care, which is the OSCE exam, again, a similar trend is found in that they tended to have lower grades in the virtual exam compared to the physical exam. And in addition to that, the number of grades were also lower. And when we asked the students what happened, the majority of them said that it's due to the unfamiliarity of the exam, as well as the difficulty in navigating the e-platform. So what happened now? Well, we are in the new norm. So our early endemic phase ended on the 31st of May, 2022. And from the 1st of June, we in Brunei, Darussalam are now in the new normal or the new norm. So in the new norm, we are allowed to have physical attendance at workplace. We are allowed to have physical problem-based learning, tutorials, practical sessions. Our clinical placements have resumed, but with strict PPE. Our examination has now reverted back to physical, although the university will still allow online examination if we feel it is required. For all students undertaking clinical placements, the ART are required before attendance at those sessions. And of course, we will have to still adhere to whatever SOP the Ministry of Health has put up. So the reason why we were able to shift towards the new norm, it's because of our successful vaccination program, which was started on the 3rd of April 2021. As of 2 days ago, 78.3% of the population of Brunei had 3 doses. So for Brunei, a complete vaccination means 2 doses plus 1 booster. And I'm glad to inform that all our students are fully vaccinated. And recently, a few days ago, our mask mandate has been removed, although Ministry of Health still advise the public to wear masks if they see fit. So this is what has happened for in the teaching and learning in the new norm. As I said just now, as far as the lectures are concerned, it is now blended. We can either have it physical or we could have online learning. We found that our clinicians are quite happy to carry on with the online learning because they could actually carry out to deliver the lectures from their place of work. So they do not have to travel all the way to the university. As far as the other sessions are concerned, the problem-based learning, communication skills, and student projects, it's all now face-to-face. And as I said just now, as I mentioned just now, the hospitals and clinics are now open, and the students are welcome to do their clinical placement, but they would have to wear their PPEs. For written paper, we have now reverted back to physical exam, and the OSCE, as well as the students' research presentations, have all now been reverted to physical assessment in the new norm. So, what are the plans for the future? Well, we all know that the impact of the pandemic is unprecedented, and it has obviously presented unique challenges to all the medical schools and healthcare institutions. And one thing is for sure, nothing will return to the way it was before, even after the current pandemic subsides. So we need to look at adopting new educational system, one that is safe, sustainable, and equipped for all unexpected scenarios in the future. Therefore, we have to invest in virtual learning. We have to create more online platforms. The platforms must be easy to use for both students and for faculty. We know that the value of physical in-person learning will never be replaced. But one thing's for sure, virtual learning is here to stay. So it is best just to combine the traditional learning with virtual learning, which can then offer the best of both worlds and may even be sustainable in the long run. We have to ensure in our teaching, that all medical students are well trained in the use of PPE and well versed in infection control measures. The other thing which is probably worth looking at is whether we need to review our medical curriculum. Is it time to look at the hours and the time allocated for subjects such as infectious diseases, infection control, public health, occupational health, and virology to ensure that undergraduate students are better equipped and anticipate and plan for challenges in the clinical practice. For example, in our own curriculum, when we looked at the time allocated for all these subjects, they made up less than 24% of the time. So perhaps we should look at the curriculum and maybe allocate more time for subjects such as infectious disease, public health, and infection control to better prepare our students for future pandemics. The technology-based teaching modalities that we use successfully in some instances, they must be continuously evaluated for effectiveness and sustainability when it is applied to the medical education. And one important factor is that we need to determine whether the technology that we use for teaching and self-learning actually fulfill the desired learning objectives for our students. The faculty must be continuously offered training in order to upgrade their IT knowledge and skills. And faculty development is obviously a very important aspect of this in online teaching as well as course design skills, and of course, using learning management systems as well. That's the end of my lecture, I think. Yes, it is. So thank you very much for your attention.